Hi everybody, my name is Shelby Kenna and I will be presenting a project on Parkinson's disease. I have a lot to cover, so let's just get right into it. So what is Parkinson's disease? Parkinson's disease, otherwise known as PD, is defined as a chronic progressive neurodegenerative disorder that affects predominantly dopamine-producing neurons in a specific area of the brain called the substantia nigra. It is considered a movement and sensory as well as a neuropsychiatric disorder. PD is the second most common neurodegenerative disorder that affects 2 to 3% of the population, 65 years of age or older. 60s is the normal age range for onset of PD, but there has been instances where people as young as 18 years of age have been diagnosed with PD. All right. What causes PD? The causes of Parkinson's disease is still largely unknown. There's been a lot of research about it, and they're still not really concluding anything. Some researchers believe that the main causes are genetic factors and environmental factors. I believe it's a combination of both, so do they. On this side picture I put over here, on the right side, it's a brain of a Parkinson's patient. And on the left is a normal brain. So with people with PD, there's a severe loss of nerve cells in the substantia nigra, which is that part of the brain that I was just mentioning. It's decreasing this neurotransmitter dopamine, which is involved in motor control and also coordination. So as you can see, there's a significant decrease in dopamine levels from someone with a normal brain compared to those with PD. So some signs and symptoms or clinical manifestations of PD. In the beginning stages, you might see someone with a mild tremor. You might also see them with a slight limp or decreased arm swing, so they might just kind of be walking and you won't see that arm movement. But as time goes on and the disease progresses, it takes a while because it's a slowly progressing disease, you might see shuffling of the feet or propulsive gait, or loss of postural reflexes, or even slight change in the way that they're speaking, so their speech pattern. The shuffling is very common. You might see someone taking small steps, or they're kind of not doing the heel-toe action, so that's what they're saying with this. Some primary motor functions or motor symptoms. The tremor is one of the most common motor functions that you might see that's a symptom. Also rigidity, bradykinesia, postural instability, those are all very common. Tremor, you could have it resting or postural tremor. So resting tremor, they normally have this tremor when they're at rest or in bed, but as soon as they start movement or start getting up and moving, the tremor will go away. Postural tremor is the tremor that they have due to a decrease in good posture. So you might see them slumping over. This is normally with the trunk or the head. You might see a tremor there. Rigidity is very common as well. Bradykinesia is the slowness of movement. You might see people freeze in this case. They're shuffling their feet, they're not walking fast enough, and then all of a sudden they hit this wall, as you can say, and they freeze, and they might fall at that point. So that's very scary for a lot of people with PD. This is a big issue with some people. And also postural instability is another one. They have weakness, they have an inability to pull their trunk up and keep good posture. So some special considerations. Medications can impair the autonomic nervous system functions. It's important to know the medications that your patient is on, especially if they're switching medications back and forth depending on what it is. It could cause specific symptoms that might cause issues when you're treating them. Like, for example, if they have low blood pressure and they're taking a medication that could even lower it even more, you might need to know that if you're working with them in something like a physical therapy clinic or an occupational therapy clinic. Cognitive decline and dementia are also very common with people with PD. They're not motor symptoms, but they are common for the elderly populations. Um, Another consideration, it's important to incorporate or emphasize fall prevention. Balance training should be also emphasized, just because these are two very important things for people with PD to consider. They need to really focus on what they're doing and what they're balancing, so we don't have any falls. Also, avoid using dual tasking or multitasking. So don't have them do a bunch of things at once. That could cause them to freeze. It could cause a bunch of different things that we don't need to have happen. And then also visual and auditory cueing is important, and it helps improve their gait. Management and treatment. Medications is one of the most common for people right now with PD. I put a little picture on the side here. It shows like the different wavelengths when symptoms are controlled or when they're not controlled. So at those times when they're not controlled, you need to really focus on what's going to benefit them at that point. Should they be doing this? Should they be doing that? Just until the symptoms go away and the fading effect doesn't come back. You need to make sure that you have a proper exercise prescription for them or daily activities that they can do that isn't going to cause any complications during that time. Deep brain stimulation is another common one. Exercise is the most important, I feel like. I've listed a few exercise techniques or different kinds of exercises that are good for people with PD. Relaxation, flexibility, strength, functional training, getting in and out of bed, balance training, locomotive training, cardiopulmonary training, and group home exercises. These are all very, very important. So here's the case study. Patient profile, 68-year-old retired male presenting to physical therapy with a 7-year history of PD. He reports having complaints of cervical pain, neck pain, decreased walking speed, decreased energy, difficulty holding objects, and he has a decrease in his speech, so quiet speech. He notes that he has not completed exercise for the past 2 weeks, and he had just gotten back from a vacation with his wife, and he reports not being able to eat dinner with her due to inability to lift his head and eat due to cervical pain and his kyphosis that he has. I've also listed some of his medications here to keep in mind what the symptoms are for each of these. Complaints or complications. So the male has glaucoma, or he had glaucoma. He has glaucoma. He has low blood pressure. He also has bowel irregularity, and he was diagnosed with skin cancer in 2007. These are good things to keep in the back of your mind when you're working with people, specific patients. His complaints are cervical pain due to abnormal posture, decreased mobility, decreased endurance, decreased balance. So we're going to work on all of these when he gets his prescription for exercise. Objective/subjective findings. These I'm just going to go through quick. We did a sit to stand, a getting in and out of his car, basic bed mobility, and turning when he's walking. He found mild difficulty with the sit to stand and the turning, but he found moderate when he was getting in and out of bed and getting in and out of his car. So those were important to keep in mind as well for when we give him exercise prescription. We observed that he has severe forward head, severe increase in kyphosis in his back during static and dynamic exercise, and a mild decrease in lordosis. So he's got a lot of posture issues. So we did ask him some questions. He has not fallen in the past year, but he does report having a fear of falling, and he feels like he is at risk for falling due to his disease that he has. Decreased gait, he has decreased step length, he's taking shorter steps, decreased speed, he's slowing down, decreased bilateral heel strike, so he's walking on his toes, he's shuffling, and poor dynamic posture. So we had him do a sit to stand assessment. He did it 5 times, 12 seconds. Balance assessment. He weaved in and out of balls. Took 20 seconds for one round trip, so up and back. We did a ball throw, a ball clap. He did 10 consecutive ball claps in a row without failure. He stood narrow base with his feet together for 60 seconds, and he had more issues with single leg stands, so bouncing on one leg, and tandem stands, bouncing as if you're walking a straight line. So functional goals he had were to be able to complete a floor to stand transition with one upper extremity, so holding on with one arm, be able to work on his home exercise program as prescribed by his doctor or therapist, begin walking program 4 to 5 times a day. He likes walking, so we wanted him to get back to walking properly, safely, and improve static and dynamic balance, proprioception, so knowing where he is within space. He, as an individual, wanted to get back to golfing and to be able to do things with his wife without any complications. So here's his prescription. Aerobic, resistance, flexibility. Aerobic, 3 days per week. Resistance, 2 to 3 days. And frequency for flexibility, greater than 2 to 3 days. Moderate intensity for aerobic, 40 to 50% VO2 reserve, heart rate reserve. He should do it for about 30 minutes, and it could be anything prolonged and rhythmic. For resistance, 40 to 50%, 1 RM, because he's a beginner. He doesn't lift weights, so we would consider him a beginner. One set of 8 to 12 reps of that, and then avoiding free weights, so we want him to have that assistance with weighted machines. And then full extension, flexion, rotation for flexibility. Hold it for 30 seconds, 10 to 30 seconds, but he should hold it longer, 2 to 4 times. And slowly. So here's some exercise type ideas for him. He can go do relaxation exercises. Yoga is a really great one. It'll help him with his posture, really stretch, calming him down, kind of relaxation. Tai Chi is a great one. Flexibility exercises, working on range of motion, stretching, passive positioning, just general strength training exercises, whatever he wants to do in that case. Just because he does have weakness, but that's not our most important thing we want to focus on. Functional training is a very important one. We want him to really practice on bed mobility, being able to get in and out of bed. Posture exercises is going to be a great one. Being able to do wall posture, different neck posture exercises, really focusing on bringing his body up and not having that tucked in position. So he can do some sit to stand transfers or standing training. So when he's golfing, he'll need to be able to stand for long periods of time. Balance training, sorry, and group. Sorry about that, I had a little cough. But he would be able to do group home exercises with other people who have PD, which would be great for him. Doing yoga with other people, or dancing is a great one for people with PD. Dancing with PD with other people that have the same disease. So for more information, visit these websites. They're all great. They provide a lot of information, and I'm sorry for that. I'm sick. But that is all that I have, and I hope you enjoyed my presentation. Thank you.